All right, I think we're live, man. Push one in the chat if you can hear me. So you knew I was munching? Yeah, I usually don't eat after 8, man. I had some plantanos, some crispy plantanos. So, welcome back to the Black Brain Trust. This is episode 545, Black Pandemic Chat. Please hit the like button as you come in, share the video if possible, hit that notification bell so you get all the updates from the Black Brain Trust, including those posted on the community tab. There's a doc in the description beneath the video for you to follow along with. If you want to engage in the discussion, there'll be a link in the chat for you to click on. When you click on the link, make sure you raise your hand so that one of us can acknowledge you and advance you to the panel. Let me make one more adjustment and then we'll get started. Give me a few seconds. All right. All right, let's get started, man. Get started with the first item on the docket. I don't think it's going to take us very long. All right, this is from Wired.com. COVID-19 will accelerate the AI healthcare revolution. Just want to cover this real quick. On New Year's Eve of last year, the artificial intelligence platform Blue Dot picked up an anomaly. It registered a cluster of unusual pneumonia cases in Wuhan, China. Blue Dot, based in Toronto, Canada, uses natural language processing and machine learning to track, locate, and report on infectious disease spread. It sends out its alert to a variety of clients, including healthcare, government, and business and public health bodies. It had spotted what would come to be known as COVID-19 9 days before the World Health Organization released its statement alerting people to the emergence of a novel, what is this portion? Novel coronavirus. Blue Dot's role in spotting the outbreak was an early example of AI intervention. Artificial intelligence has already played a useful but fragmented role in many aspects of the global fight against the coronavirus. In the past months, AI has been used for prediction, screening, contact alerts, faster diagnosis, automated deliveries, and laboratory drug discovery. As the pandemic has rolled around the planet, innovative applications of AI have cropped up in many different locations. In South Korea, location-based messaging has been a crucial tool in the battle to reduce the transmission of the disease. 9 out of 10 South Koreans have been getting location-based emergency messages that alert them when they are near a confirmed case. In China, Alibaba announced an AI algorithm that it says can diagnose suspected cases within 20 seconds, almost 45 times faster than human detection with 96% accuracy. Autonomous vehicles were quickly put to use in scenarios that would have been too dangerous for humans. Robots in China's Hubei and Guangdong promises to deliver food, medicine, and goods to patients in hospitals or quarantined families, many of whom had lost household breadwinners to the virus. In California, computer scientists are working on systems that can remotely monitor the health of the elderly in their homes and provide alerts if they fall ill with COVID-19 or other conditions. These snapshots of AI in action against COVID-19 provide a glimpse of what will be possible in the various aspects of healthcare in the future. We have a long way to go. Truth be told, AI has not had a particularly successful 4 months in the battle of the pandemic. I would give it a B minus at best. We have seen how vulnerable our healthcare systems are. Insufficient and imprecise alert responses, inadequately distributed medical supplies, overloaded and fatigued medical staff, not enough hospital beds, and no timely treatments or cures. Healthcare systems around the world, even the most advanced ones, are some of the most complicated, hierarchical, and static institutions in society. This time around, AI has been able to help in only pockets of excellence. The reasons for this are simple. Before COVID-19 struck, we did not understand the importance of these areas and act accordingly. And crucially, as far as AI is concerned, we did not have the data to deliver the solutions. The first is that data, always the lifeblood of AI, is now flowing. Kaggle, a machine learning and data science platform, is hosting the COVID-19 open research dataset, COVID-19, as is known, compiles relevant data and adds new research into one centralized hub. The new dataset is machine readable, making it easily parsed for AI machine learning purposes. As of publication, there are more than 128,000 scholarly articles on COVID-19, coronavirus, SARS, MERS, and other related terms. The second is that medical scientists and computer scientists across the world are now laser focused on these problems. Peter Diamandis, founder of the X Prize Foundation, estimated that up to 200 million physicians, scientists, nurses, technologists, and engineers are now taking aim at COVID-19. They are running tens of thousands of experiments and sharing information with a transparency and at speeds we've never seen before. The COVID-19 Research Challenge, also hosted on Kaggle, aims to provide a broad range of insights about the pandemic, including its natural history, transmission data, and diagnostic criteria for the virus, and lessons from previous epidemiological studies to help global health organizations stay informed and make data-driven decisions. The challenge was released on March 16th. Within 5 days, it had already garnered more than 500,000 views and been downloaded more than 18,000 times. Early in the outbreak in China, Alibaba released that AI algorithm trained on more than 5,000 confirmed corona cases. Using CT scans, it can diagnose patients in 20 to 30 seconds. It can also analyze the scans to diagnose patients and quickly assess health declines or progress. Based on signs like white mass in the lungs, Alibaba opened its cloud-based AI platform to medical professionals around the world, working with local partners on anonymous data for deployment, including modules for epidemic prediction, CT image analytics, and genome sequencing for coronavirus. So I'm not going to read this whole thing because I think we covered this before. I feel like we have. But we talk about AI a lot on here, in that there's a necessity um, to really get some literacy behind AI, machine learning, deep learning, reinforcement learning, and health science. You know, if you have a community college near you, you should be able to actually, you know, do a double major at some of these community colleges, at least some of the more broader ones connected to the bigger universities. You should be able to get an associate's degree in health information systems, which is actually a very critical career path at this point. We can see it happening right now. Not enough people who know information systems in the healthcare field really, you know, really can, you know, be useful in this area. So let's see who just joined us. We got Super Triz with us. What's going on, man?
What's going on, Mike V?
Chilling, bro. Chilling. You have anything you want to add to COVID and AI?
Well, I mean, I think you pretty much touched on it. I mean, like obviously we realize the application of artificial intelligence, machine learning, basically data driven solutions tracking, and you know, you kind of have an amalgamation, you know, of the healthcare continuum and information systems when you talk about informatics. So you have not only the ability to kind of interface with that data, but also allow you know, particular healthcare professionals to better utilize that data. And I think that's one of the issues that we have, is that a lot of these actual programs that we use um, for patient care is not necessarily utilized to its fullest potential, because you have systems that, you know, in which you enter data is automatically collected. You have information of things, point of care perpetuals that utilize information of things kind of interface, such as like a glucometer or a vital signs machine, things of that nature. And you're inputting that data. And so you have this data compiled. And the information itself, because of just form field technology, which is it, I wouldn't say necessarily technology, but form fields have existed for quite a while now. Excel is a prime example. Microsoft Excel. So you have that data, the various reports necessary to kind of track, you know, progression of diseases and, you know, epidemics to pandemic considerations. The data is already there to do it. You just have to kind of configure the systems to actually run those reports, and that way you can kind of track the movement and see which type of treatment modalities have the highest level of efficacy. And that could take a lot of the menial, I'm going to necessarily say menial, but a lot of the tedious work, you know, out of that data component. So that way you can do more with less personnel. Obviously, you're still going to need some type of personnel to kind of oversee that process. But if you have a system in place and is utilized properly, which I don't think at this point in time is utilized to its fullest potential, then we can have better control over some of the things that we see now, in particular with this COVID epidemic.
Yeah, how comfortable are you with tech on like a 1 to 5 scale?
I would say 4.
Oh, yeah.
I'm quite comfortable. Now there's some things like, okay, so like on the front end, I would probably say 5.
Okay.
But there's things that can be done on the back end that I really haven't studied. Like, for instance, I use Epic.
Yeah.
I've used Meditech, I've used CHCS, and I currently use Epic at this moment. And Epic I think Epic could really be streamlined. One of the things that I think really needs to happen. So say for instance, you have PC versus console, right? So a lot of times the a console version of a game will have some things on the front end that make the user interface more intuitive, right? You may sacrifice some functionality,
Mm-hmm.
but it's far more intuitive than a PC counterpart, which has a higher level of customization. But for the end user to increase workflow and productivity, you want something that has a high level of intuitiveness.
Mm-hmm.
And I think that's where, say, for instance, video game software architects and engineers and things like that can be utilized outside of that video game, and entertainment venue, and actually implement their skill set into the healthcare continuum and make a lot of these programs, such as Epic, more intuitive. Because I think Epic right now, when you look at some of the menu items, it's just a whole lot of stuff in there that really doesn't need to be there. And I think that there should be a way to further customize it for the end user, given their specific application, as opposed to having like a standard system that everybody uses. And, for some people, like say, depending on your role and responsibilities, there's a lot of features that you don't utilize. Some features you utilize more frequently. And Epic has tried to make that more intuitive, but I think it could be taken to the next level with the injection of people that don't necessarily function within the healthcare continuum, but have a lot of innovative ideas as far as front end presentation, such as video game developers.
I meant from like the I guess from the coding aspect. But yeah, you're right about Epic and Meditech and whatnot. I'm only asking because I think that one of the hard hit areas for a lot of brothers, man, is especially for Black people, is that there's a lack of literacy and comfort around emerging tech like AI and stuff like that. And so that becomes critical in times like this, because that will determine whether or not you move up into different areas of the healthcare field.
Well, that's one of the things that I've kind of looked at, and that's kind of why I made my segue into the ICU from vascular access, is because one of the things that's looked at with favor when you apply to an informatics curriculum is that you've actually, or you're currently working in ICU. And so that's something that I'm thinking about getting into, is the actual informatics aspect, because that's where things are going. And I think that one of the selling points, obviously, is if you can increase workflow, because dollars always make sense, as you move up the chain. So you can find ways to increase productivity, and increase profit margins, but at the same time increase patient outcomes. That's always going to be in demand.
All right, let me get to this next item on the docket. This is from Engadget.com. Fitbit's in-app study will determine if wearables can detect COVID-19. This should be very interesting. I was how they'd be able to do this. Fitbit is venturing beyond its research partnership to launch an infectious disease study of its own that's very easy to join. The device maker has introduced a study inside its app that will help determine if smartwatches and fitness trackers can spot early signs of COVID-19, the flu, and similar diseases without waiting for symptoms. If you're at least 21 years old and live in the US or Canada, you can volunteer by filling out a questionnaire regarding your health. Fitbit will combine that with activity data to see if there are any telltale clues, and ideally build an algorithm that alerts people before they infect others. The study is available in the app's Discover tab under Assessments and Reports, and you can withdraw at any time. As with studies from Scripps and Stanford, there's no guarantee this will lead to a usable detection system. There's still a lot of humanity, there's still a lot humanity doesn't know about COVID-19. If Fitbit succeeds in finding an algorithm, though, it could both improve understanding of the disease and help isolate infected people before they have a chance to spread the illness to others. I don't know, man. I'm not sure how a heart rate sensor would be able to determine if a person has COVID. It really beyond me. I don't know. I'm not really familiar with medical devices in that area, but this is it's just a tracker, and it only it tracks your steps and your heart rate and the calories burned. But how would it be able to do that? It's really something, man. I don't know. I guess if you yeah, this is really weird. Unless
Well,
it has yeah, go ahead.
Well, I'm not sure what the capabilities of the Fitbit are beyond heart rate monitoring, but perhaps they will incorporate at some point the ability to perhaps even monitor temperature with a Fitbit. I don't know if that's something that's in the works, but as far as heart rate is concerned, some of the symptoms um or an actual elevated heart rate can be indicative of sepsis. So like outside of physical exertion, like if you maintain an elevated heart rate, your body that can be kind of a response that your body has to a systemic infection. But that's just, again, you know, trying to get these these wearables involved in that process is kind of dicey because number one, um how reliable is the data extrapolated from a Fitbit, right? I think it can be used as kind of like perhaps a early warning type tool, but not necessarily something definitive that people should be counting on as, hey, this is a sign and symptom that I may have some type of infection, or the fact that I'm not getting an alert from my Fitbit means that I'm okay. So if that makes any sense to you.
No, that does. That does. It's kind of like a radar system, a cheap radar for that matter. But I don't know. It, I mean, if you're working out, you're gonna your body temperature will increase, right?
Well, I mean, like outside of, so basically, if you have a Fitbit on and you're wearing it, if you wear it continuously, which a
Mm-hmm.
lot of people do because they track their steps and they're wearing it
Mm-hmm.
when they're not necessarily working out per se, then you can kind of monitor for temperature trends and changes, and then sustain elevated temperature outside of your normal, workout regimen. So that would be something that may be used as a diagnostic tool to kind of say, hey, maybe there's something else going on here. I should maybe go and get checked out. So if that makes any sense.
No, it does. It does.
But again, like to use it as something definitive, obviously, I don't think that's what I don't think they're trying to say that they plan on having it used as something definitive. But at the same time, I think that has to be made abundantly clear, particularly for the end user, because some people, look at this and they'll say, oh, well, my Fitbit, hasn't given me any alerts, so I should be perfectly fine, which may not be the case. You know what I mean?
Yeah, yeah. I think there may be an opportunity from the tracker community, at least, to collect um, location data and for contact tracing. That's the only thing I can really look at. I can't imagine it detecting anything else, but for contact tracing, it does make a lot of sense because you can kind of map out where they walk to, because all your steps and stuff and things like that are recorded and then connects to the GPS, either on the watch or on your phone, because it'll leverage what they call a synchronous GPS, and it'll kind of leverage a proximity as to where you are and where you've been in your travels. And so that would actually give a good proximity to, you know, contact tracing at the very minimum, you know, for COVID. Whether or not you went into a hotspot, and if you did go into a hotspot, how long were you there for? How close were you to, you know, a potential person who did have, who may have been tested for COVID, and so on and so forth. There's a lot that can be pulled from that part, but from in terms of detecting, I think they would have to develop a device that does have a built-in thermometer, and I suspect that that's going to be the new case going forward. That all of these devices going forward, these wearables going forward, will have some kind of like thermometer built into the wrist.
But you know what, with that type of technology to be effective, you have to have buy-in from the end user. Mm-hmm. A lot of people are concerned with intrusiveness and privacy. So even if you have the technology available, at the end user level, they may be able to limit how that data is utilized. If that makes any sense.
Nope, it does. All right, this is from fastcompany.com. Telehealth's future is bright. Here's what it'll look like in 2025. 9-minute read, brutal. You're sitting at the table eating dinner when you receive a notification. A woman wearing a light blue top fills the screen of your phone with a video message. Hello, this is Diane in Dr. Halpern's office, the woman says. The computer saw that your blood sugar and heart rate numbers went out of range yesterday and today. I'd like you to set up a quick virtual visit, okay? That's where telemedicine could be headed in the next 5 years or so. It won't just be virtual, it'll also be proactive, hyper-personalized, and data-driven. Lots of people are having their first experiences with telemedicine right now as a result of the pandemic. They like it, and they'll very likely expect to be able to continue accessing healthcare in this way after COVID-19 is long gone. The healthcare industry is notoriously slow in adapting new technologies, but COVID-19 may prove to be telehealth's watershed moment. There's honestly wasn't much change from 2008 when I started to really up until very recently, says Doctor on Demand, Chief Medical Officer Ian Tong. Then all of a sudden, not only have patients done this for the first time, but this is literally the first time that most doctors have had to even think about it, and were literally forced to change their models in some cases overnight. With the new wave of investment likely flowing into digital health startups, including telemedicine providers, it's a good time to ask how exactly telehealth will change the way we receive medical care. In short, the digitalization of healthcare may change the whole paradigm, where receiving care means going to where the doctors and all the magic tools are. Medicine might finally start coming to the patient digitally. When most of us hear the term telemedicine or telehealth, we imagine talking to our doctor on a laptop, but over time, these terms might come to describe something far more fundamental. American Well founder and CEO, Dr. Rory Schoenberg, sees telemedicine as the patient-facing front end of the healthcare system, where more interactions with patients will be digital. We are now looking at healthcare in the same lens as when people brought books from Amazon, because that was the only thing Amazon was selling, Schoenberg said. But we completely fail to understand the dramatic impact of online retail, which was championed by Amazon. Telehealth is going to be for everything. So that's the corner that we're turning right now. In other words, the narrow set of things health providers can do for us via a Zoom call today will soon include a broad set of services that are delivered through things like apps and connected devices. A doctor's inability to listen to my heart rate, to my heart during a virtual visit might be solved if I have my own digital stethoscope and an item that's widely available now. The doctor might even be able to watch me take my own blood pressure during the virtual visit to make sure I do it right, then read the results I upload. These kinds of connected medical devices are already here. The diabetes management company OneDrop sells a kit and an app for measuring blood sugar levels and reporting the data to the doctor or other caregiver. Alive Coles, Alive Cole was Alive Coles Cardia device creates a medical grade EKG that can detect atrial fibrillation, bradycardia. I don't even know if I'm pronouncing those right. Triz, are you familiar with these terms? All right, Trish is away, so I'll skip those terms. With some of the help from the company's AI algorithms, a quick search finds FDA approved.
I'm sorry, I was muted.
No, that's fine.
Atrial fibrillation and bradycardia. So the atrial fibrillation component is a arrhythmia of the atria, like the chambers that actually receive blood into the heart, as opposed to pumping blood out of the heart, which the ventricles do. So the atrial fibrillation, generally speaking, atrial arrhythmias generally aren't what's the word I'm looking for? They aren't like life threatening per se. In its immediacy, like say for instance a ventricular arrhythmia is, but atrial fibrillation can lead to blood clots because of that blood, the way it's swirling around in the atria. And so that can cause problems, obviously, with blood clots. And then the actual bradycardia decreases the cardiac output, as does atrial fibrillation to a certain extent. But the bradycardia in particular decreases cardiac output, which can lead to what you call syncopal episodes where people like pass out. It can cause problems, especially if you're driving and you have some bradycardia, or you're walking up some stairs and you have some bradycardia. You can pass out. So that's what that stuff is.
Okay. A quick search finds FDA approved connected otoscopes. I never heard of that before.
That's like an ear, like basically to look into the ear.
Okay. Which helps physicians look inside your ear, as well as numerous blood pressure monitors, wearable blood glucose monitors, and many other connected health gadgets. Telemedicine platforms often review these devices and integrate with the ones they prefer. These devices will get much more advanced in the next decade. Just imagine the life of a diabetic patient where they are carrying a skin patch or contact lens that measures their blood sugar, Schoenberg says, and how much more accurately you can treat them with the insulin and with medications to make sure they don't have all the complications of diabetes that come with poor control. Telemedicine appointments where patients at home transmit diagnostic data to a caregiver is just one scenario. Many schools, workplaces, and remote clinics have someone with medical training on staff who can conduct diagnostic tests and pass them on to a remote doctor. This is actually an image of connected devices in telehealth. At least 2 digital health companies are building full kits of connected diagnostic devices that can be paired with more traditional telemedicine. Gail from Silicon Valley based 19 Labs looks like a small medical chest with a number of connected medical devices hidden inside, including a stethoscope, pulse oximeter, digital thermometer, and otoscope. A built-in display shows remote doctor visits and recorded how-tos for using the equipment and treating specific illnesses. Similarly, New York-based Taito Care makes a handheld health monitoring device with attachments that transform it into various diagnostic devices. Data collected by the device is sent in real time to a doctor video chatting with you on a companion smartphone app. The kit sells for $300 at Best Buy and works with most of the major telemedicine providers, including American Well and Teladoc. This is interesting. Why would Best Buy be wanting to sell something like that? I wonder if Best Buy is looking at all that real estate that they have in there and saying, well, maybe we can turn this into a sort of clinic too. Very interesting. I'm surprised that if anybody would sell it, I would have thought that, it would have been Amazon or something, but Best Buy? Interesting. Diagnostic testing could be approached in other ways. The Health System Association is starting to test mobile labs to bring X-ray, ultrasound, and blood work screenings to patients at their own homes. The test results would be transmitted to virtual doctors who can use them to inform diagnosis and treatment. Such a remote clinic might use Butterfly Network's smartphone connected ultrasound device, which is meant for use only by trained health practitioners. There's also a growing wave of digital health apps that rely on smartphone features to collect diagnostics data. The Australian company ResApp Health makes a number of apps that use a smartphone to record and transmit the recording of a cough. Tel Aviv-based Healthy.io makes an app that uses the smartphone's camera to measure aspects of a patient's urine. Wait, what? Let me read that again. Tel Aviv-based Healthy.io makes an app that uses the smartphone's camera to measure aspects of a patient's urine.
Yeah, so when you're talking about urine, you one of the things that you look for is what's called turbidity. And that's basically like if the urine itself is cloudy, you want to look for sediment. You want to look for concentration of the urine. So these are some of the things that you can utilize without necessarily having laboratory equipment, just to kind of see the patient's status based on observation of urine. So
wow,
that's something that we do now. Like, if I go see a patient, and they have like an indwelling catheter of some sort and they're collecting the urine, I could just take a quick glance at the urine and see if there's some type of change based on, just various factors that are present in the urine. Like I said, the cloudiness, sediment, the concentration, and then the amount itself, like how much they're putting out per hour.
Wow. That's new to me, man. Man, that's something new.
And I think a lot of that with the proper programming, artificial intelligence can actually discern some of those things, like, and make judgments based on that. Obviously, it's not definitive because there are some things that really you need laboratory testing to get a finite answer. But obviously, if you have like some type of computer attached to a camera, that computer is going to be a lot more precise than the human eye. Yeah. So it'll be able to notice some changes that wouldn't necessarily be seen by a human eye. Because, like, if you take urine, for instance, right, urine is going to if urine is concentrated in appearance, you can surmise that if you did like an actual test of the osmolality, it would be high just by looking at it, but you wouldn't have a specific number. But if you had like a computer that was programmed, there may be able to get like a ballpark estimate of some of these values that normally we would have to have laboratory testing to determine.
Wow.
So a lot of this stuff is basically, well, I'll let you finish the article and we can get into, what I think a lot of this stuff is for.
Yeah. Researchers at the Center for Eye Research Australia, CERA, developed a tablet app that uses computer vision to recognize early signs of Alzheimer's in the eye of the user. The more these devices and apps can do, the more digital doctor visits may be able to replace in-office visits. Expect to see much more investment in startups that advance these digital health devices and find ways to transmit more kinds of high quality clinical data to healthcare providers. Doctor on Demand's Tong says this work will accelerate as more doctors become involved in developing that technology. Because now you have a lot of physicians who were otherwise not putting much thought, or health systems that were not putting enough investment or thought behind their virtual care capabilities, and now they have to, he says. Doctors on Demand Tong says that follow-up appointments, which are one of the healthcare industry's biggest and costliest pain points, are an obvious opportunity for telehealth. Treatment plans often go off the rails when patients skip follow-up appointments, and many of them end up returning to the clinic or worse, showing up at the ER. What happens in reality is most people start taking those meds. They feel better, and they don't follow up with that visit with their doctor simply because it's an inconvenience. It's another missed day of work, Tong tells me. And that's when patients often stop taking their meds, stop monitoring their symptoms, or return to normal habits too soon and end up getting sick again. I think with telemedicine in the future, people are going to be more apt to do those follow-up visits from the convenience of their home or at work, Tong says. That not only allows the physician or hospital to capture the revenue for the follow-up appointment, but it keeps the patient on track with their treatment. To this day, caregivers have precious little vision into the lives of their patients between office visits. Medication adherence has been a well-known problem for decades, and there's still no standard way of knowing if people are following the directions on the pill bottle. But in the future, a digital health integration with a pharmacy system might inform a doctor if a patient has failed to fill a prescription. Modern smartwatches have gradually added data collecting sensors that could be potentially useful to caregivers. But unfortunately, it's been mainly the so-called wealthy and well who have embraced wearing such devices every day, not people like the diabetic or obese factory worker with a history of heart trouble. However, that could change, especially if the patient sees wearable devices as a natural extension of the doctor's stethoscope. That's when the crucial wellness and preventative potential of digital health can happen. When those devices detect that something is going the wrong way, the clinician shows up on your phone with a matter of a minute and says, "Hey, we just detected that you have an arrhythmia." Never heard of that before. And this is what we're going to do about it, Tong says. Personal health monitoring may have started with wrist wearables, but there is a growing list of options. In the future, we'll likely see things like hearing aids that also listen to heart rhythms, finger rings that monitor skin temperature, and other vitals, in clothing with built-in sensors for monitoring body temperature, heart rate, and other metrics. Yeah, see, this sounds cool, but my understanding is that there's a lack of doctors. We're understaffed in doctors. We're understaffed in nurses. Who's going to be the point of contact for all of this?
Well, here's the thing. What this technology would do is it would decrease the need for such a vast number of healthcare providers, because as it stands now, there's a lot of vacancy in positions. A lot of positions go unfilled because there simply aren't qualified personnel to actually fill those positions. When you start talking about some of these healthcare fields, it's a lot of schooling involved, and it's different from some of the other things because there's what you call continuing education requirements that are necessary just to maintain your ability to practice in a given state. Just like, for me, I have to have so many hours of continuing education every year just to maintain, my actual licensure in my state. So when you look at it from that perspective, um, like a lot of this data that's being collected, um, you already have implantables that actually collect data. Some of them, say for instance, that article mentioned an arrhythmia. So one of the implantable devices that comes to mind is what's called an AICD, automated implantable cardio defibrillator. So it's basically like a device that's almost like it's like a pacemaker, but has extended functionality in that once it detects certain arrhythmias, it will automatically deliver a shock to the patient to kind of correct that arrhythmia. So because it has the ability to detect certain arrhythmias, that data can be transmitted to, say for instance, a doctor's office. Because you have less actual inpatient stays, because this technology is able to kind of catch things before they get too out of hand, then you have those additional personnel that might have been displaced because of a diminished amount of inpatient stays. Now those people can actually be, can actually take on the role of monitoring this incoming data.
Mhm.
There's always something to be done, but I think the desire is the transition from uh, what you call primary, secondary, tertiary care. Um, you want more of a primary care based model. You want to prevent people from actually being inpatients. So a lot of that requires early detection and early intervention. Um, some of the data you can't necessarily get from a patient, because a lot of data that we get is based on a patient's report or a patient account, and sometimes patients are poor historians because it's hard to remember everything you've done. And then there's patients who are just dishonest for whatever reason. Maybe it's pride or embarrassment, whatever the case may be, but they're not necessarily honest about some of their habits, and so we're unable to form an actual picture of what's going on outside of the inpatient continuum. When people are at home, they're doing certain things. My father is a prime example. He doesn't necessarily adhere to his medication regimen. If certain times he'll just, I'm not taking my medicine. But then when you come into the doctor's office, how many days have you missed your medicine? A
Mhm.
patient's not going to memorize that type of stuff. And so when you come into see the physician, they're making adjustments based on the data that they've extrapolated from your diagnostic procedures, such as maybe you got some lab work done, you got some vital signs taken, some everything that they've done to get a clinical picture. But the missing component is, what is your actual compliance? So if, say, for instance, they say, okay, my blood pressure has been steady rising, even though I've been on these medications. So the physician's like, okay, well, we're going to raise the actual doses of your medication. We're going to add on this medication. So now we go from, maybe you were just taking lisinopril, now you're taking lisinopril, Norvasc, and you're taking Correct. And so now you've added on all these medications, but previously the patient wasn't necessarily compliant. But now the patient's like, okay, well, I'm gonna start taking my medicine, but now it's an increased dose. When really and truly, all the patient had to do was take the medication as it was initially prescribed, and they wouldn't have the symptoms that they're having. But now you've not only increased the dosage, but now the patient is actually compliant and they're taking the medication every day. And so now they come back into the hospital because now they've had, maybe they have bradycardia or they have hypotension because they've been over medicated. So what this technology will do will prevent certain things like that happening, because this is something that we see all the time in the healthcare field. Um, we make doses, we make adjustments based on what the patient told us, but the patient wasn't being completely honest. And so then we're going back and forth, back and forth, back and forth. And all this really equates to is rising healthcare costs. And as we know, the United States has some of the highest healthcare costs in the world, yet we don't have the highest patient outcomes. So
Yeah.
something's wrong with that picture. We're spending more money than anybody else, but that actual actual increase in healthcare expenditures isn't congruent with our patient outcomes, and that's a problem.
High mortality rates.
Yeah,
and also high costs for drugs and the treatments and so forth. So since there's a very large economic component behind what's going on here, that drives up medical costs certainly as well. And that's a big part of the problem. That's why, having a nationalized healthcare system would take care of a lot of those problems. Because there are a lot of people that I see who are actually taking drugs, have medications, have plans, but their drug costs is also so high, and so in some respects cost prohibitive. Sometimes their insurance doesn't cover it. Some people sometimes are short on money on getting their medications. They don't take it based on that as well. People don't want to talk about that, but that's part of the equation that's in that problem, or that's part of the problem that's in that equation, I would say.
Yeah, let me finish reading this last paragraph. As wearables generate more precise measurements, we'll likely see more startups that specialize in receiving, analyzing, and presenting the data to caregivers via a dashboard. Their software products might even integrate biometrics data with other patients' information from the electronic health record, then apply AI to the data set to look for patterns. Insights from this analysis might trigger a proactive video call to a patient's phone before they realize something's wrong. Tom says this sort of biometrics-driven remote patient monitoring might be handled by a non-physician member of the care team, which could free up doctors to spend more time with patients who are sick and need in-person care. Handled by a non-physician member of the care team. Who could that be? A medical assistant?
Well, there's a lot of people that are non-physicians that are members of the healthcare team. Like you have nurses, respiratory therapists. I mean, pretty much anybody.
Yeah. While this vision for the future of telehealth is one of many startups betting on, it depends on something outside of their control, a healthy broadband infrastructure. And it remains true that in some of the least healthy parts of the country, accessible mobile and fixed line broadband service is a real problem. Video conferencing with a remote doctor is a high bandwidth application that requires a steady signal. And some of the things we will ask digital health to do in the future, like transmitting high resolution medical imagery, may require even faster commercial grade connections. We've heard from some patients that even when other modalities are available, they prefer to have a video visit with their provider, says Dr. Lauren Brofman, research scientist at the telehealth provider Ro. For telemedicine to become a truly comprehensive service where people can be treated holistically for their needs, the technological infrastructure needs to be there. Yeah, 5G. I mean, we've been talking about that for the last couple of years, that 5G is a necessity to all of these things. It's impossible to run this without 5G. Okay.
Well, you also talked about that new antenna technology.
Oh, yeah.
That may make, because some people live in areas, in particular, that's one of the concerns in healthcare, has been a concern, is rural health. Like I get job offers all the time to go work in a remote area. Because the access to healthcare is kind of diminished there. So if you have if you can actually integrate this type of telemedicine model, and then if you have that antenna technology, which will make high bandwidth accessible to those areas, kind of like a match made in heaven.
Yeah, that certainly would sound like an issue. That certainly would sound like a definite solution. Now let me ask you, Mike, 4G or Super Trids. Well, I don't know how much you're up on the 4 or 5G stuff. You may be very knowledgeable about it, but would 4G also suffice?
No.
That we have that out
there? No. You start talking high resolution images. You need put it like this: 4G works at anywhere between 25 to 35 megabits per second. 5G works at 2,000 megabits per second.
Yeah, for sure.
right? So it's just not sufficient. It's not even sufficient right now. That's why you're seeing a lot of, YouTube had to make a lot of adjustments. Zoom, is slow and things like that. Is because it's overloaded. You can't have this many people working remotely and working from home and whatnot, and have this sort of old 1970s infrastructure. This is unacceptable. Even now, you can't buy a laptop in the stores right now. Laptops most stores are empty for laptops and tablets.
Yeah.
Oh yeah.
Yeah, that's fact.
This is crazy. This is not. What COVID did. It exploited and exposed all of the technological inefficiencies that this country has, and no one wants to admit that there's no reason why Comcast and RCN and these other companies should be charging us $300 for internet service, when in South Korea they get the same service, if not better, for $20 a month. Something's not right, man.
Yeah, it's pure rape, and we're also seeing which of course sit in our community hard. Talking about telehealth, and also basic education is hitting our education hard. My son and my grandson, excuse me. He lives in a nice area, so he definitely has what he needs for school. But a lot of kids who are in some different areas don't have that, and they're not getting proper education because of the fact that they don't have proper internet service, as you were saying. Internet, and can't really afford all this heavy duty kind of these heavy duty kind of payments. I do know that in some communities they get some subsidies, don't they, for their internet services? I guess that's what some of these people get, maybe.
Yeah.
I think they do, but still, the costs are still very high. So, you're totally right about the costs on that. That, like I said, that are affecting health and education, healthcare and education.
Mm-hmm.
Two very key areas.
Previously,
yeah.
Well, previously, see, and that's one of the questions that I posed on some of our other streams, and I talked about, as a society, we have to determine what are necessities and what are luxuries, and what is the base level of base level lifestyle that is acceptable for somebody, in what you would consider to be a developed, society. And so when we start talking about internet, previously internet wasn't necessarily a necessity, but as we progress from a technological standpoint as a society, things that were once considered just mere luxuries are now actually a necessity to interface with society at large. And
That's
so
right.
now internet itself is that's going to be a necessity if we move forward with that telehealth model, which I believe is inevitable to move forward with that particular model. Internet, and not just internet, but like an actual high speed internet.
That's right.
It's like it's going to be an absolute necessity to be able to interface with this particular technology. And so if it's going to be a necessity, then it becomes an issue of, well, as a society, westernized civilization has more of that capitalistic mindset, supply and demand. If there's a low supply and a high demand, I'll just jack up the price.
That's right.
But because now it's a necessity, the government has to step in and say, oh, no, you're not. Or the government can step in and, okay, we'll subsidize. So we have to decide, are we going to subsidize, or are we going to mandate that these internet providers actually charge what we consider to be a decent price?
Well, either way, they're going to have to do. And then, of course, those are great points. That's absolutely the case. And the government is going to have to step in, as you said, in any way. They're definitely going to have to step in. They're going to have to step in, either price regulate or subsidize. And I think for the government, it would be cheaper for them to price regulate than having to write checks. So they're going to have to give these guys a haircut. And they're going to try to fight against that, But I think there definitely should be some price regulations on this, because there's no question about it. The internet now is a necessity. I had a telehealth conference on the 19th, just with my doctor, and I didn't particularly like it because they had the office closed or whatever, but they had to do their telehealth thing, ask me a whole lot of questions over the phone and all that, and usually I'm used to just going into the doctor, having somebody put a stethoscope on me and listen to my heart sounds, listen to how I sound. And they're saying, well, you can get a follow-up, but a lot of these hospitals right now and doctors, they're not really taking a lot of patients in right now, and they're trying to see if you have COVID and everything else like that. So the system is clogged. And I have to say, my experience a couple of days ago, I didn't like it. So it's not what I'm used to. So I still don't think it's sufficient. But I guess this is what we're going to have to deal with. And our healthcare system is broken. It's totally, the Brazilians have a beautiful term for it. The sistema é foda. The system is screwed. It's fucked up. Telehealth hopefully can interdict in certain kind of ways, but you're gonna have to see someone. You have to have somebody to check you. I'm an older guy now. I work out hard. I do certain kind of things. So I gotta check my heart. Gotta see how all that shit is working. I don't know, man. We still have great challenges, but certainly the internet, 5G, and all that would definitely help. I didn't know that 4G was too slow or not, or really not robust enough. Wow, that means everyone's got to go to 5G and premium cable, premium internet. Wow, it's gonna be interesting to see how this problem gets solved.
Let's go to D Raptor. He has his hand raised.
Go ahead.
DE Raptor, Mr. Porridge.
Hey. Good evening, everybody.
What's going on, big man?
All right. Hey, one of the problems why we have this war with China is because of the same technology thing.
Yeah.
People on the market in America and Europe wanting to keep technology off the market because they control the current technology. And what we are moving into, as the article seemed to be saying, is that we're moving into a time when AI really is going to take over as your doctor, unless they need eyes, because right now AI can read an X-ray. One of the things that people really haven't come to grips yet is that everything operates at a frequency spectrum. Every cell, when they look at the sun, they can tell what's going on by looking at the colors, and that's frequency. Your cells operate at a frequency, your body operates at a frequency, and there's different colors. When you're operating perfectly, your body operating perfectly, your cells operating perfectly, they have a different color to when they're not operating perfectly. So when technology moves to the place where they can see these things, then the AI can take over from the doctor and diagnose you, prescribe whatever treatment you need. And the doctor may be the one who, when you go into the office, gonna dig inside your ear and find out why something's happening, or look inside your eye and find out what's going on inside there.
Yeah.
But basically, that's what this article seems to be saying. We're moving towards that place where AI through these apps are going to be looking at you and telling you what's going on.
Yep. I wanted to make sure we got to Triz's point, but before we do that, it says Tel Aviv-based Healthy.io makes an app that uses a smartphone's camera to measure the aspects of a patient's urine. Triz, you were going to follow up on that earlier.
Oh yeah, so basically, again, like I was saying, the urine itself is very indicative. Well, people don't realize how important urine. It sounds really silly when we're basically talking about pee, but
urine is critical. Yeah.
The urine is indicative of kidney function, right? And so kidney function is indicative of perfusion. What makes the kidney so important from a diagnostic standpoint is that your kidneys are highly susceptible in changes in perfusion. Basically, that's the ability of your body to distribute nutrients and remove toxins from the bloodstream. So that's based on circulation. And the kidneys are very susceptible to changes in that. So like if you have an issue with perfusion, say for instance, you have some type of injury where you lose blood, maybe through trauma or maybe some type of disease process where maybe your blood cells, your red blood cells are diminished. Your circulating volume is diminished somehow. Your kidneys are usually the first internal organ to be affected by those changes. Your kidneys are highly sensitive. And so the first thing that will happen is your kidneys will reduce the actual urine output. And so if you see changes in urine output, maybe your urine becomes more concentrated, or the actual volume of urine that you put out in an hourly basis changes. Then an actual camera will be able to detect that. And so that will be indicative of, hey, okay, there's a bigger problem going on. Your kidneys is just a symptom of a bigger issue. So that's why there's such an importance on urine, because there could be issues with, perfusion and circulation. If your kidneys are not being adequately perfused, then some of your other organs may not be adequately perfused either. So that's the reason why, that camera will be able to tell that based on the concentration of the urine and also the urine output. And furthermore, things like sediment and turbidity of the urine can be indicative of an infection.
Yep.
So that camera itself can tell a lot of things about you based on your urine.
It can also tell how much protein is in there as well, like proteinuria and everything else like that. You'll be able to see that, which would be indicative of a disease process as well. Am I correct?
Yeah, so that protein would be something what we call sediment. I talked about sediment earlier, so we will see like sediment. I'm not sure how, if you got a camera that precise to actually be able to be able to see the protein in the urine, that's on some next level stuff right there.
Well, you factor in the the iPhone and the Huawei phone, even my new 5G One Plus phone has a 48 megapixel camera on it.
Yeah, don't some cameras operate in the color spectrum that they, like, if they can see you at night, they gotta be able to take a good photograph at night, a different kind of light.
Yeah.
Lack of light and all that, and your body. I'm not really top of the notch on this, but and then your urine, you can have blood in there, like Super Tracy, you said, blood, vitamins, proteins, and if you know where these proteins are supposed to be used, and you're getting too much of it, if you know where these vitamins are supposed to be used, and you're getting too much coming out of your body, then you getting a first hand or early view of what's going on in your body, what's going on in your kidneys, what's going on in your liver, what's going on in your intestines, what's going on in your heart, what's going on in your brain. Because if your brain is supposed to take up, if you take in, say, I don't know, vitamin K or whatever the case might be, and you take so much per day, your body uses so much a day, your brain uses so much, and you're excreting in your urine 90%. Something is going on. You know what I'm saying? So if you can find a camera, a smartphone with a camera that can detect all these elements in your urine, it's like you just find a golden nugget.
Yeah. Go ahead, Nicole. You were going to say something. I think Nagone is having his porridge right now. So I'm
Nagone looking at his urine right now.
He's probably pissed off.
Literally.
Yeah. I wonder if you can find COVID, COVID-19 in someone's urine.
Well, I mean, okay. So now we're talking about something that's highly microscopic. We're talking about virus. So I seriously doubt that we'll have that technology anytime soon to be able to detect viruses in the urine, or actually sometimes viral shedding, like some of the actual components of the virus may be present in the urine, maybe not the virus itself. But again, like this is something that'll be microscopic, so I don't think that technology would be there quite yet. But I mean, that's really, we don't need to necessarily diagnose precisely but we just need to notice that there's something wrong. So at least notice that there's something wrong, and that would prompt additional testing to kind of definitively diagnose what's going on. So I think that's the actual objective, as opposed to the end all be all solution at this point. Maybe sometime in the future, there'll be some definitive diagnoses. But at this point, type of device, early detection, say, hey, okay, something's going on with your urine. We noticed a trend where your urine is increasing in turbidity, it's increasing in sediment. Maybe your output is decreasing. We see a trend in that. Okay, why don't you come in for a doctor's visit? And then we can kind of check you out. Because it wouldn't be a one-time thing. You have to have a trend. Because a lot of what we do in the healthcare profession is based on trend. Now, if we see like sometimes a one-time occurrence is all it takes. Like if you look at somebody's urine and you see a high level of protein, or maybe a high level of glucose, or maybe even sediment or something like that. Okay, that's a prompt to come in. But maybe you have a decreased urine output, or maybe your urine is concentrated, but we only see that one time. We need to see a trend of that to determine, okay, there's actually something going on, but not just like an anomaly. Maybe you are dehydrated right now, but you've hydrated since then. You don't necessarily need to come in at that point. So, again, it's still gonna take a buy-in from the end user to consistently utilize this technology. Even if it's available, somebody has to actually take the picture with their camera, and have to wear the Fitbit or whatever type of device is going to be collecting this data. Has to be utilized by the end user, and the actual point is to make it more convenient, because it's easier just to put on the Fitbit than it is to take a day off work to go see a doctor. So.
All right, let me get to the last item on the docket. This is from Afro.com. Black CEO secures deal for $1 million face shield. Dante Lee, an African-American entrepreneur and media mogul, has finalized a major procurement deal with one of China's largest and most reliable manufacturers of face shields. Face shields, unlike face masks, are not being regulated by the Chinese or the US governments and are much easier to get through customs. For this reason, Lee has secured a procurement deal for 1 million high-quality units and is looking for entrepreneurs and retailers who are interested in making large purchases. Laboratory-grade face shields are made using PET, the same material that is used to make a typical plastic bottle or food container. They have proven to be effective in blocking viruses, bacteria, and germs, and are often used in combination with N95 and KN95 face masks. Thousands of hospitals, clinics, and government agencies across the country are already using them, but there remains a nationwide shortage. Lee says that via his company, Dante Lee International, he can help entrepreneurs, investors, and retailers to purchase the face shields at just $2 per unit and have them delivered anywhere in the US or Canada within 3 to 7 business days with free shipping. The minimum order is just 500 face shields. But his company is already in negotiation with companies that are purchasing 20,000 units of PPE equipment or more. This is going to be interesting, man. Who knew that face shields were in such high demand like this? I thought that, masks, the N95 masks were the big deal here.
Well, at my facility, we utilize face shield. They have a similar construction to what we see here on that picture. But there's a company, I can't remember what the company is, but there's a local company that actually 3D printed all of our face shields. So we had pre-existing face shields, but we had limited quantities because, we didn't really need to use them that frequently before the COVID. But when the COVID happened, a company immediately stepped up. Like I'm talking about like a week after we started having all the COVID patients, this company, a local company here in Seattle, 3D printed us a whole lot of masks. I mean, a whole lot of face shields. This face shield in particular looks like there's some type of cushioning device on the forehead area.
Yeah.
Now, see the only issue that I have with these face shields is that, like this particular design, there's some nooks and crannies that have to be disinfected. So even after every time we leave a patient care area and we take off that mask, it has to be disinfected prior to reutilizing it. And so those areas where the forehead rests, those creases, you have to kind of get in there and clean that area. So there are some inefficiencies about this design, but I mean, nevertheless, he recognized an actual void and he filled it. So kudos to that guy for stepping in and having an actual idea, bringing it to fruition, and making it profitable. I mean, hats off to him.
Yeah, this is a big deal. I'm waiting for the I'm waiting for one of these trap house ones that have that's tinted, so you can't see their face, man. They can see out, you can't see in, so you can't see their grill.
Well, we also, you're looking for the one that are diamond, diamonds instilled on the brim of it. We got to have some bling bling. And a Louis Vuitton print on the strap. What do you think?
That might be it, man. It might be the deal, man. It should stay like Supreme on it.
There you go.
Supreme
Damn,
face.
damn, too bad we can't put any spinners on it.
Mm-hmm.
They spinning.
Put some LEDs on it, man.
Yeah, that'd be totally butter late.
Yeah, be out there doing the boogaloo. So yeah, man. Yeah. I mean, there's a lot of innovation that's coming out of COVID, man. I mean, who knew that a pandemic like that would force people to come to the drawing board, or go to the drawing board and start coming up with ideas like crazy. Like the brother that we saw, Complex sent me a video this morning of this young 9, 10, or 11-year-old African boy who came up with an automated wooden hand washing machine in the village.
Well, what they say, necessity is the mother of invention. So people are seeing there's a tremendous need. So folks, the natural creative process of a man is coming out, and it's under pressure. So people are going to have to come up with something, and people are coming up with great ideas and great applications.
Yeah. I mean, this is dope, man. I'm happy for the brother, man. Although I do like the scuba diving mask more than anything else, man. I think that's a really dope idea.
Yeah, that's a crazy idea. That was awesome. We had talked about that. He started that out in Haiti, right? That was out in Haiti. Brother first started doing that.
Yeah. Yeah, I don't know what Dr. Phoenix is. I thought he would be on tonight, but I haven't, I don't know what the situation is looking like in New York. So, kind of an update. I'm not sure what's going on there. I know here they carved out a space on the first of the month at the convention center, for COVID patients, a makeshift hospital there. I mean, they have plenty of real estate in there. I think it's massive, like a stadium. So,
well, we had the Javits Center. I know they were looking at, that was wide open. You have up here in Westchester County, you've got up by White Plains Hospital and all of them. You have all these giant tents. It's like a tent, literally it's like a tent city. Mm-hmm. And Con Ed went in there and wired the whole place up, and they got the tents in there. We got wooden floors underneath there and everything else like that. That's there. It's it's they put this up. It's these pretty good facilities that they were actually able to put out there. So they're keeping that wide open now and making sure that that's ready to go because they're suspecting that there is going to be another rather serious wave getting ready to hit as well as things open up and more people, get infected as we try to move our way towards herd immunity. But that's what's going on. That's what's going on right now. The city in Westchester County is definitely amped up in some of the bigger grounds to handle, what they consider it will be coming down.
Yeah, it looks like Seattle's numbers have been going down as well. I don't know. They still haven't tested a whole lot of people in this country. So I know the Tangerine Tyrant likes to post up, the most tested people, in the world. Yeah, but you got people still within the urban centers, man, who have not been tested, and you want to open up the market. I was in a barbershop yesterday for the first time. People still walking around without masks. And, the barber said, "Yo, you got to get the hell up out of here, man. What you in her shop, man?" So, people not wearing masks into the barbershops. Barbers getting frustrated. Barbers have to certify. So this is something I found out yesterday. They have to certify. They have to get COVID-19 certifications before they can reopen.
Makes sense.
So you have these people walking in there trying to stand, like, because they took the chairs away, but the person people they're trying to stand, like, no, you have to get out. You cannot stand in here. Like it's only allocated for people who are getting their dome cut, man. If you're not getting the cut, you got to get the hell out. Well, what do you want me to
say? You know what though? Hey, that may be the best thing that happened to some of these barbershops because some of these barbershops you go to, depending on the area that you're in. Mm-hmm. I mean, you got cats that will sit in a barbershop all day long. It's like, don't you got a life?
Yeah.
It's a hangout. It's a hangout spot. That's a fact.
It's the manosphere.
It's the man.
Yeah, there you go.
Yeah, man. So, this person tried to drop their kid off at the barbershop yesterday. He was like, "Yo, you can't just leave your kid in here, for one, and number two, he doesn't even have a mask." "Oh, you mean I can't find a park space? I'm just gonna double park right here." Police pull up, you gotta move your vehicle. Where am I supposed to park? All of this anger and resentment, over the rules and regulations of COVID, man. Like one of the guys said in the barbershop, man, this is for our safety, and you're coming in here compromising us, man. Get out. Unbelievable, man. So that's the status update, man. I didn't know that, everybody had to go through COVID training and stuff like that and get certified before they can reopen their businesses. Not just barbershops, but even restaurants too. The ones who have sitting spaces. So you're only allocated to, I think, like 5 people or something like that in a restaurant to actually sit. Who would want to sit in a restaurant at this point? I don't know. I don't see what are you going to do? Eat with your mask on? What's the point?
How do you do that?
Yeah.
And it only takes one person to infect everybody. So
yeah, I wore my mask even when I was getting my haircut. So
was the barber wearing his mask while he was cutting your hair as well?
Yeah, the barbers can't operate their business without having masks on, and they have to have all PPE and stuff like that. There's a whole entire certification process for barbers, so they have to, and they can't let anybody else into the barbershop until they clean the chairs and the floors and stuff like that. It's a very long, tedious process. So,
are they charging more for cuts now?
Oh yeah, the price on them went up, man.
How much for a Caesar in Boston?
Oh man, it was like $50-$60 now.
Damn, are you serious?
Yo, they hurt it, man. You gotta pay that rent somehow. You paying $400.
I understand. Right now, I got a salt and pepper fro, so I'm a little tight about that. So,
What's your Yankee fitted?
Oh, I got my Yankee fitted, but they ain't fitting too good, man. Ain't fitting too good. So I ain't gonna lie. I'm prepared to pay. I'm prepared to pay a C-note for a haircut. I didn't think I'd be doing that, but I said, yeah, I'm prepared to do that. Yes, I will do that. Yes, I will.
Yeah, Mr. G in the chat said he's paying 50 for his on this Saturday. So he said it's just for his
Listen,
beer.
y'all cats, I told y'all, well, was it a couple weeks ago? I was like, y'all need to go down to the store, get you a pair of clippers, some adjustable clippers and some edge up clippers. And this is your opportunity to learn how to cut your hair, man. Because you know what?
Bro, the price of the clippers on the went up trip, man.
Nah, man, I gotta look right, man. If I think I'm doing it myself, man, I'm all sideways and turning around, all getting all acrobatic, man. Nah, bro, I'll be capping my shit. I'm looking crazy out here. So
yeah, hey,
I
ain't
definitely
gonna
want
lie,
somebody.
like I said before, like them bathroom selfies with them chicks be sitting on the edge of the countertop, the bathroom countertop. Like, hey, that's what I gotta do to cut the back of my head, man.
Man, I ain't trying to do that, man. Shit, I ain't trying to get all with Cirque du Soleil on my head, man. Nah,
Why can't you wear a do-rag over it, Tris?
A do-rag over what?
Over your head, man.
I mean, I technically could because I work in the hospital. We can cover up our head at work, but even when you know what? Since there's COVID, I don't go anywhere, right? Yeah. I go to work, I go to like maybe the grocery store, and I go home. Like I haven't been going anywhere, but even still, like I'm just the type of person where I gotta look right even when I'm sitting at home. Like today, I didn't go anywhere. I got up and I got completely dressed to sit at home. Damn right I did. I got up, I took my shower, I shaved, I brushed my hair. I go through the whole routine because like every time I walk past the mirror, if I'm looking crazy, I don't feel right. Like I gotta just for my personal comfort, like it's a certain way that I gotta be.
Yeah.
Even when I'm at home.
Yeah, totally agree. Agreed.
So yeah, I got up. I got up this morning. I got up at like 6:30 this morning. Mm-hmm. Did my whole routine, and ain't went nowhere.
Crazy.
Well, it's funny. I'm walking around here in the neighborhood. Folks is out in the hood. They're walking around, in the street. They're dressed nackily and all that. They dress nice. You have some people in their jogging stuff and all that. But people are coming out, and these male folks. A lot of these male folks walk around here. They want to be looking proper in public. So folks are in their houses, but they're coming out dressed up. So if you come out looking all torn out the frame, folks, folks are gonna look at you like you ain't living right. Oh, he ain't living right. It's a problem. So it's really funny. So people are coming out.
You come out there looking crazy. They go be like, oh man, he must not have got his stimulus check yet.
Shit. He had that big crib. He didn't get his tip joint. So it's funny, but that's why I keep a hat on my head, and then I got the puffy stuff coming out the side. I like the fro because I ain't had a fro in a long time, but I got the big puffies coming out. But and yes, I do have my Just for Men. I'm sorry, I do put a little dye in there. I ain't gonna front. I ain't even gonna try to front on it. I do put a little Just for Men up in there every now and every 6 weeks. But the fro is coming in, man. I'm like maybe I might try to Ice Cube Steve for a little while. I don't know.
Well, I mean, to go and check it out, man. You know what?
Go ahead.
And Mike V, chime in on me. Chime in if you feeling me on this.
Go ahead.
And the gone, listen, get you a blowout kit. Jerry curls.
No,
going psycho.
Man. See, my man, he mad at me. No, man, my man talking about Jerry Curl. Shit, my man trying to get me shot out here.
Look.
You trying to have me fucked up out here?
They gonna be like, damn, Nicole, you got that good Indian hair.
Yeah, you got me fucked up out here,
got that good Indian hair.
I can't be looking like that. I can't be looking like that. I can't be looking Jerry Curl. Oh, fuck. Anyhow, man, that's crazy. I knew he was gonna come with something crazy, man. Come on.
They gonna be like, oh, man, Nicole, you must be mixed. You got that good Indian hair.
Come on, man. Man. Go ahead, man. Go ahead with that, man. Go ahead, man.
The go, like you some kind of Dominican or something?
What's going on, man? Some people already think I'm Dominican, man. I walk out here with Jerry Curl, niggas will be like, "What's wrong with this nigga?" Because we got the same Sosa.
Hey man, I got this Dominican dude at my job. Man, he he got a Jerry curl, but his hair is like that's like it's just his hair texture, but he got a Jerry curl at my job, and he rock it.
Man, I ain't seen a Jerry curl since the '80s, fam. I'm sorry. So
So my uncle still got a Jerry curl.
Hey, Nicole, can you braid hair?
Can I braid hair?
Can your hair be cornrowed?
Oh yeah, it get cornrowed heavy right now. Hell yeah. Like, my hair grows long. I have long hair. I mean, I have long hair. In college, I had a ponytail for a little while. I mean, it was ill, but I thought I was the shit though. But I was a kid, but I can still grow hair.
Okay.
Yeah. It grows long. So yeah. Could I cornrow it up? Yeah, but I can't be cornrow it up right now. I'm a bit old for that, man. That's for them youngsters, man. I ain't in my 20s no more and all that. That's over. So I just either I'm a throw it out or I got to go back on my fade game. So and that's the problem. I can't do that shit on my own. I can't do it on my own. I'll be looking all fucked up. I can't get that right. So I need some professional hands to handle this.
You got a brother, man. He can help you out.
Man, I wouldn't let that motherfucker cut my dog's hair, man. You think I'd let that motherfucker touch my head? Forget about it.
Yo, man, this phase one opening phase for businesses, man, with the barbershops, man, it was crazy out there, man. People are lined up out there around the block. Good thing my barber and I have a good rapport. He had texted me and let me know he was going to be opening up and that he was going to save a seat for me. And sure enough, he was right on the money. He's right on the money with it, man. But yeah, a lot of guys, man, they're not taking cash like that, man. They're kind of wary about cash, man. If it ain't brand new from the bank, man, they don't really want that.
Nah, they look at that cash like that shit's got COVID on it.
Yeah, hey, you know what though?
Real?
It's crazy because so you got I got a couple things at home. I got a Bowflex and I got to add a couple of adjustable dumbbells. Mm-hmm. And so I was like the other day I was like, man, I wonder if somebody got some more dumbbells. And I just looked on Craigslist and somebody had just posted it within like 4 hours. Some dumbbells. And this was early in the morning time, so ain't nobody had really looked at the Craigslist yet. So I called him up and he was like, yo, I need fresh 20s. Like no other type of bills. Like I need some fresh 20s. Hopefully you can go to the bank and get some new ones. So I got my money at the bank and I got me some new dumbbells. So I got me some 75-pound dumbbells too.
Oh man,
yeah, because they're hard to come by, and he only wanted 200 for him.
Damn.
See, that's my problem. I'm getting 200 frames because I got one guy who's supposed to be sending. Now my brother, he lives across town. He's got 125-pound DBs, and I'm like, this is what I need. I'm not hitting no heavy ass weight. I need that. Mm-hmm. So he's like, I'm out carrying these things up and down my stairs to bring them over there. Hell with you. So he's keeping them over there. So I'm ordering a pair of 130s. The guy's got a pair of 130s on Craigslist. They're a little bit older, but I'm not gonna tell you what I'm paying for them. But he's literally trying to jack me up. But I'm used to hitting it a certain way, and this is what I got to do. I got to get reduced to getting hijacked.
That's
weight.
what it is. But what's crazy? Like, okay, so it's kind of like going off on a tangent. But when we talk about the actual prices of dumbbells, how they've jacked up, dumbbells, any type of workout equipment, people have really jacked up the price. But when we look at the general public sentiment towards large businesses in the way that they actually do business based on supply and demand, and they inflate prices based on what they feel they're able to get from the customer. But then you have people doing the exact same thing when they have the opportunity to do so themselves. Mm-hmm. So it's kind of hypocritical for people to, and I get it, but at the same time, it is hypocritical to denounce an activity in which you engage in when given the opportunity to do so.
Mm-hmm. Yeah. I can understand them jack up the weights. I don't like them the real issue I have with all this gouging is with the medical industry and the stuff that's critical. Do I think weights and stuff are critical? To me, yeah, they are exceedingly critical. But you know, just the medical industry and what's going on there, and the mask game and all the PPE stuff that we have, and you know, people getting torn out the frame for that. It's just I can't get it. If you want to jack me on some weights, all right, I'll deal with that. But this other stuff, this other most critical, is to me is what's obscene. That's the real problem I have.
Mm-hmm. No, I can dig it, man. I bought all my stuff last year, so I was pretty good going into this. Even now, the calisthenics bars out there, you know, there's a line, man. If you don't get up there by 8 o'clock in the morning, man, there's a line out there at the playground, man. So
it's a line, and plus, if you want to go to Rogue or something else like that and get a good squat bar and all that kind of stuff, you're waiting a month, 2 months for this stuff. You're waiting a long time for this crap.
Oh yeah.
You're waiting for it.
Yeah.
Well, you have people that are buying this equipment. You have people that are ordering this equipment just for the sole purpose of reselling it.
Yeah. You have your resellers out there. Yeah. You definitely
gonna have a lot of sore losers in that.
You definitely gonna have your resellers, but I'm not trying to resell them. And I'm one of these 130s. You know, they're heavies, and you know, and they're rubber. You know, they got the metal, but they got the rubber covers on them. So I just want to see what kind of condition they're in, and hopefully they're in good condition, because you know, I got to get back to getting live again, man. And this is rough, but I'm getting jacked for secondhand weights. It's fucked up, but it is what it is.
Man, you know what? You just got to check that Craigslist kind of frequently and catch a deal like I did, man. Because I got my 25-pound. Now these are the quick adjustable ones, like where you just slide the pin. You don't have to take off any. Everything is one piece, but it's like this pin that you slide back and forth to adjust the weight, and then like you lift it out of the carrier, and it leaves the weights in the carrier to subtract what you want to lift. And so almost like the Bowflexes, but these are like smaller. These are like only 25 pounds, and I got those for $40, a set of 2 for $40. And then I got my 75-pound dumbbells. These are like Ivanko dumbbells, 75 pounds. And they're the metal ones. They don't have any rubber on them. And I got those for $200. Just a good deal. Got lucky.
Yeah, good deal.
All right, listen to here, man. Thank you all for joining us. Please hit the like button if not already done so. Share the video if possible and hit that notification bell so we get all the updates from the Black Brain Trust, including those posted on the community tab. So thanks to Super Tricks for coming through and blessing us with some of that knowledge, and shalom to everyone else.